Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. So as I've alluded to about the dissolve and resolve culture, I'm talking about hyaluronidase, and we have spoken about hyaluronidase or hyalase previously before. You'll find some of the links to those previous videos in the caption or description below the video. So on TikTok, there are like over 50 million views about filler dissolving. It's become almost the norm, or it's become really fashionable. So filler dissolving involves dissolving hyaluronic acid fillers with a substance called hyaluronidase. So things like polylactic acid biostimulators and calcium hydroxyapatite cannot be dissolved by this enzyme. Hyaluronic acid and hyaluronidase or hyalase is naturally found in our bodies, and then we have a re-engineered synthetic type. There's Hylenex, which is human derived, but it's derived from bees or like some sort of animal bovine derivative. And what it does, it breaks the hyaluronic acid into smaller particles, and that is an off-label use. So it's actually used more for enhanced drug delivery. So when we are using this drug, which is hyaluronidase, to dissolve filler, it is off-label. It's not for that use. I know it's used a lot in ophthalmology as well. And when we do these treatments for patients, there is also a consent process. So just like talking you through it, but like going back to this 50 million views thing. So it's become almost trendy to dissolve your fillers. So if you think about Courtney Cox or Kylie Jenner, I'm not like into kind of off celebs actually, but they are out there, and it is a good visual for people and patients to have in terms of having a lot of filler and then the filler going away. But out there, and I haven't seen them, but there are these online forums where they report that having extensive hyaluronidase has damaged their face. They have denting, they have volume loss. So can hyaluronidase cause this? So there hasn't been any proof or studies that show it does. So what it does is it dissolves the filler, or it breaks it into smaller particles. It also dissolves your endogenous hyaluronic acid. So when we do these treatments for patients, I often say, straight after the procedure, I mean, it's within seconds really that you get softening of the hyaluronic acid or the filler, but you look really dehydrated. Your lip will look super flat after the treatment, but your endogenous hyaluronic acid is broken down and replaced on a daily basis. It's just as we age, over the age of 25, you just make less and less hyaluronic acid, but that endogenous hyaluronic acid is replaced. So give it a week or two, and it's back to where it should be. But if you have years and years of overfull lips, overfull faces, that skin is stretched because it's not done artfully, tastefully, safely, or it's just done on a year-on-year basis without really examining, listen, how the results look, is there still filler there? So sometimes when it is dissolved, you get exceptional deflation, and that has to be remedied with skin tightening, some regenerative medicine treatments. There are ways to help that, but you also have to think really hard before you do a procedure, like before you embark on a filler procedure, as well as before you dissolve. So we have an informed consent for everything, even for our chemical peels, and it does list there the possibilities of treatment, and sometimes you have to have that treatment more than once. We do have an ultrasound if it's a difficult area, or it's seemingly unresolved, or the filler is encapsulated. You can see exactly where the filler is and precisely dissolve that filler. So that is also available to us, but it's a very emotional thing for patients to have their filler dissolved. So I've dissolved my fair share of non-emergency case, that means non-vascular occlusion fillers, mostly in the lips and under the eyes. And the oldest filler in around the mouth that I've dissolved was, going back 10 years, and under the eyes 8 years. These things stick around for a long time, and the patients were emotionally prepared for it. They've had other treatments. We had a relationship with the patient before, so it's something that can be done safely, like physically as well as emotionally and mentally. So even if there's these bags, or there's something called jellyfishing where the filler is coming out down the mucosa, like where the wet dry border is, it's not right. The patient knows it's not right, but they're quite attached to it. They're so used to it, and they're scared about like what's going to happen when all of this is gone and all of it goes flat. So there is a bit of counseling before dissolving is done. Also, again, with the informed consent, one of the things that we are fearful of or take extra care with is allergies. So there is a possibility of hypersensitivity type 1 anaphylactic shock with the hyaluronidase, but they use it extensively in ophthalmology, so there isn't really any of that. It could be related to filler or the inflammatory nature of, if there's an inflammatory nodule, if that is like upregulating the immune system, why it may be more common in aesthetics, or why we may fear it more in aesthetics, because that is a possibility. And then there's these things, sometimes in aesthetics we all, like I'm talking about us as an industry, sometimes make stuff up, you know. So there is this thing called patch testing. It's not a patch test, so it's injecting the hyaluronidase into the skin, making a little bleb. So it's an intradermal test, but we're not allergists and we are not pediatric pulmonologists, so you know, we can't diagnose, is this a hypersensitivity type 4, hypersensitivity type 1? So it's almost like a useless test. I think we do it, or people do it as a reassurance that the patient is possibly not allergic, or it's a very irritating substance, hyaluronidase, and it's highly concentrated when we mix it. So it's normal that it irritates the skin. So those are one of the myths that are prevalent in the aesthetic industry, including putting a lot of cheek filler in will lift these folds. That's also another myth. But it's important. It's an important procedure that you learn about, that you do an informed consent on, and also have know the limitations of the hyaluronidase. Sometimes not everything can be fixed with this hyaluronidase, and instead of going into this dissolve and resolve culture, or thinking it's cool to have a come with me, a get ready with me while I go get my filler dissolved, it's not okay. Especially if you do it and keep on doing it, full resolve, and full dissolve, you can get some scar tissue there. So remember, your skin is an investment, your face is an investment, your health is an investment. And I always say every little thing you do to your face, even if it's a micro needling, completely changes the trajectory of your aesthetic. So just keep that in mind.